for staying with us. A recent report from the United Health Foundation is revealing North Carolina's strengths and weaknesses, particularly when it comes to caring for seniors.
To learn more this morning, we are talking with Dr. Ravi Johar, the Chief Medical Officer for United Healthcare. Thank you for being with us.
Oh, thank you so much for having me. It's a pleasure.
Yeah, you're welcome. So if you could just tell us some of the notable findings overall in this study.
Sure. Absolutely. America's Health Rankings is actually a publication put out by the United Health Foundation. This is the 12th annual edition of this. And this report focuses specifically on the needs of seniors because we know that seniors have different healthcare needs than a younger population. And we looked at over 52 different measures of health from 24 different sources, ranging from the Census Bureau to the CDC to state and even local reports. And then we ranked the states on how the health of their seniors is. And North Carolina ranked they have some improvement. They're ranked 33rd in the country as far as the health of seniors. But we look at a number of different things. Some notable things that were really positive was that we saw a great increase in the amount of high-speed internet availability to seniors, up over 20%. And that's really important because of telehealth and also the ability to stay in contact with others, because we know that loneliness is a real factor with seniors. So that was really good. We also saw a decrease in the early death rate, which was really good because that's an important factor, and an increase in the number of geriatric providers. On the downside, we saw a tremendous increase in poverty, over 6% increase there. And then we also saw a big increase in housing insecurity. That means seniors that are spending more than a third of their monthly income on housing went up by 3%. So that was fairly significant.
So those are some of the national takeaways. What about North Carolina specifically? What were some of the weaker factors for our state?
Well, as far as weaknesses in North Carolina, the biggest thing obviously was poverty, which went up quite a bit. So that's something that I think needs to be looked at. The fruit and vegetable consumption among seniors in North Carolina was 45th in the country. And along with that, there was also exercise. They were 42nd in the country. So a combination of those two factors is something that's not so much associated with money, but in just habits of getting out and being able to eat healthier and exercising and visiting with your neighbors. So those were a couple of the big downsides. On the upside, one of the things that was real significant was that the food insecurity, the ability to get some kind of food, was down by 41%, which is fantastic. There was also a increase in geriatric clinicians. That was up considerably, almost 28% increase in the number of doctors that specialize in senior population. So that was real uplifting there.
That's wonderful for our viewers to hear about that. Dr. Johar, what can we take away from some of these findings? What do you believe we need to know moving forward to make sure our state, stays on the up when caring for seniors?
Sure. Well, the idea of this report is that we can get this data into the hands of the lawmakers and policymakers so they can look to see what areas they need to focus on. North Carolina ranks 5th in the amount of money spent per senior. So they're spending a lot of money, but is it going to the right areas? Are they addressing the needs that really need to be addressed? And so the idea of this report is to get that data out there and also let states look to see what other states may be doing better in an area they want to focus on and try to learn together so that we can all grow the health of our seniors across the country.
And really quickly, Dr. Johar, you said this report, you've been doing it for 12 years now. Was there anything new this year that you were looking at?
Yeah, I mean, some of the new things that we looked at this year was a lot on disparities among folks with disabilities. So someone who has cognitive disorders, which is real common with seniors, how they did compared to ones that didn't have cognitive disorders. And one of the really neat things we looked at was how much unpaid care is being given. So from family members or friends, unpaid senior care. And that was very heartening to see how much care is being given to our family members and friends by others in the community and their families. So that was a really uplifting thing to see.
Just touching on some of the highlights here of this report. Thank you so much for your time and going over all of that. And folks at home, you can find the full report over on americashealthrankings.org.